High blood pressure is when your blood pressure is elevated, of course. Your blood pressure is elevated if your blood pressure is higher than 120 over 80. We said that in the past that if your blood pressure is 140 over 90, it's okay. But nowadays, if you have 140 over 90, you are classified as a moderate hypertension. So those patients with elevated blood pressure, they need to be on, first of all, lifestyle modification, and second, they have to be on medication. The problem with the high blood pressure is that the heart start pumping harder to make the blood to go through the arteries to supply oxygen for the tissues. So if your heart have to pump harder, the heart is a muscle that start growing, and in some point that muscle is going to have not enough circulation, and it's when the patient is going to have cardiovascular disease because the patient get what we call congestive heart failure. That's why the patient needs to have good control of the blood pressure, because we want our pump and the patient's pump to last at least 100 years. But you have to force your heart to pump harder and often. In some point, the heart is going to stop doing the way we are looking for. In that moment is when the patient start having problem with the congestive heart failure or coronary artery disease. Alcohol increase your blood pressure. Eating too much salt increase your blood pressure. Having obesity or being overweight increase your blood pressure. So if you really want to control your blood pressure from the beginning, you need to understand that you need to make changes. Do I have to take medication for blood pressure? Not if your blood pressure is mild to moderate and we can make the numbers better. But if the numbers are not better, you need to understand that you need to take medication. But everything starts with changing lifestyle.